And one of the first things that I did when I got started is I traveled to Harrisburg, Pennsylvania to see Wendell Potter in the State House Capitol. We had a big rally there, and you were there, Donna Smith was there, Chuck Pinocchio put it all on, and that was the first time I saw you. Then I saw you again in Philadelphia when you and Michael Moore met, and that was a really exciting presentation. But Wendell used to be an insurance company executive. He worked for Cigna, and decided that he just couldn't do that. He could not keep doing that. And so he quit that job, became a whistleblower, testified before Congress, and now you're a co-president of Business for Medicare for All. Is that correct?
I'm president. That's correct. Yeah.
President, yeah. And that's a really great endeavor. So I'm hoping you can give us some tips on how to bring in businesses to support us, as well as maybe how to understand the jargon of the opposition, and why now is really the time to be pushing this. You know, why does COVID make this the time to push this? So I'm going to turn it over to Wendell, and the floor is yours.
Thank you so much, Debbie. I remember that day in Harrisburg so well. It was actually one of the first public events after my congressional testimony that I did. Certainly the first time I spoke at a rally. That was now some years ago. I also want to thank you, Debbie, for your advocacy. Thank you, Barbara and Bill and Matt, for your service and for pulling this all together. I just wish that we could be together in person, but this is a pretty good substitute. And also bring greetings from Richard Master, who is the founder of Business for Medicare for All. Some of you have met Richard. Many of you have seen the movies that he has produced and that I've been a part of. He's just an essential advocate and someone who has really been helpful in supporting the work that I've been doing and this work broadly. So thank you all. Look forward to having a conversation with you all. I'll talk for a few minutes, but my favorite part of any talk that I give is the interaction with those who are in the audience. So I look forward to talking with you, answering questions as best I can. I might note that in my first career, I was a newspaper reporter. I was a journalist in my home state of Tennessee, and I mention that because I think it's kind of relevant to the decision that I ultimately made to leave my career in the health insurance business. Even though I had a very good and interesting career in journalism, not only was I able to cover state politics in Nashville and Memphis and other parts of Tennessee, I had a chance to cover Congress and the White House and the Supreme Court in Washington for Scripps Howard News Service. And I left that job, though, and got into public relations work, and never would have planned it, but I accepted calls from recruiters, and that led to taking jobs with Humana in Louisville, Kentucky, where I worked for a little over 4 years, led communications there. And then I was recruited to Cigna, and I worked there for almost 15 years, actually. And I left after what I've often referred to as a crisis of conscience. I went back home to visit family in Tennessee. Some of you have heard this story. And while I was there, I read a story in the newspaper about a healthcare expedition that was being held not too far from where I grew up. My hometown is Kingsport, Tennessee, and this article was about an outdoor healthcare fair that was being held at a county fairground. And I went there out of curiosity and saw something that just changed my life. It was a day that I had a true epiphany, and it was the beginning of this journey that I'm on. I saw people who were standing in lines waiting to get care that was being provided in barns and animal stalls. And I just never would have imagined that our healthcare system could have disintegrated to the point that it had, that people who I could have grown up with, people I could have been related to, were standing in lines to get care in barns and animal stalls. And I realized also that what I was doing for a living as head of communications for Cigna, was helping to perpetuate a very broken system, a very dysfunctional system, and a very unfair and overly expensive system. And I realized that what I was doing for a living was the exact opposite in many cases of what I did as a newspaper reporter. So I made a commitment that day to try to figure out some other way to earn a living. It took me some time, though, to really act on that. And it was actually a few months later that there was an incident that occurred that was really the straw that broke the camel's back. I, among other things, had to handle high-profile cases or complaints that people who were enrolled in Cigna plans might have and would take to the media. And in December of 2007, I got a call from a reporter in Los Angeles who was asking why Cigna was refusing to pay for a liver transplant for a 17-year-old girl in Los Angeles. I hadn't heard of this. I assumed that I could just make this go away and there would be no media interest in this after a day or two at most, but this was different. The family was very resourceful. It turned out that a medical director in Pittsburgh had decided that the liver transplant for Natalie Sarkeesian would be inappropriate. So he denied it. The family appealed that decision, it didn't work. So they decided to try to shame Cigna. And that did work. They brought a lot of bad publicity that I had to deal with. I was on the front lines of having to defend the company. Ultimately, the pressure became so intense that the company decided to reverse that denial and pay for the liver transplant. It didn't have a happy ending, however. Just 5 hours after Cigna agreed to cover the transplant, Natalie passed away at the age of 17, 5 days before Christmas. And that was it. I didn't have it in me to work for an insurance company to handle those kinds of cases because I knew that was just one of many, many cases in which people were not getting the care that they need. And I will tell you, this is not something that just happened in the past. It happens every single day, every day. 10 years or more after the Affordable Care Act was passed, if anything, it's gotten even worse. Health insurance companies have more and more put themselves right between doctors and their patients. So I left. I turned in my notice pretty soon after that, and as Debbie noted, I began working with healthcare advocates. I knew that we needed to have healthcare reform. I didn't know how I could play any kind of a meaningful role. I went to Washington and raised my hand to try to work, I thought initially, and the way I would prefer it to have been, to work behind the scenes, just to help advocates know how the insurance industry really operates and how they plan to go about killing reform if they possibly could. This was just right after Barack Obama had been elected president. But I was persuaded that if I really wanted to make a difference, I needed to go public with my story. And I eventually did, and testified before Jay Rockefeller's Senate Commerce Committee in June of 2009. And it was soon after that, Debbie, that I made that trip to Harrisburg at Chuck's request and met you and Donna and many others who have been in this movement now for a long time. I'll switch to present day because 10 years have almost passed since then, if not 10 years exactly. And we've come a long way. Our movement has grown. We've gotten very much closer to achieving Medicare for all or single-payer health care. Certainly, I know many of us were very disappointed that the candidates who were advocating for Medicare for all at the presidential level have suspended their campaigns, and now it looks as if Joe Biden is going to be the nominee for the Democratic Party, and of course he has not embraced Medicare for all. But it looks as if this movement is, if anything, is taking on more strength, and I think that we will absolutely see that this is not only a movement that has legs, it's going to intensify. And in particular, I think that the coronavirus pandemic is bringing into focus for so many people just how insecure our system is, how we can no longer rely on health insurance companies to provide access to our health care. I want to focus on that to a large extent, but I also want us to talk about what we can do as advocates to make sure that this movement continues to go forward. But this pandemic is something that I think, as I said, can really be useful to this organization. As that in itself may sound inappropriate, but I think it is opening the eyes of so many people who have said that this is too much of a heavy lift. We cannot achieve Medicare for all. The powers that be are too powerful, and so this may be, in many people's opinions, still just a pipe dream. But I think this pandemic is changing that. We've already seen polls that have shown since this pandemic began that support for Medicare for all has continued to go up. Morning Consult did a poll fairly recently that showed that there was a 9% increase in support for Medicare for all just since the beginning of this pandemic in the United States. And we saw also, even before that, in the Democratic primaries, as some of you probably know, that in every single one of them, and that includes Tennessee, where I grew up, and South Carolina, and other red states, that those who voted in the Democratic primary, the majority told, as they were doing entrance and exit polls, that they supported Medicare for all, even knowing and being told that it would eliminate private insurance. So that was extraordinarily important. As it turned out, a lot of those people voted for candidates who were not championing Medicare for all, including Joe Biden. But it's very significant. And other polls have shown not only do Democrats support this in large numbers, more than ever before, but also independents and a large number of Republicans as well, too. So we know that we've got a lot of support and growing support. And this pandemic in particular is showing just the absurdity of having healthcare access related to having a job and where we work and whether our employer offers healthcare benefits. We've seen that already 26 million people have lost their jobs, or at least I'm sure the number is more than that, because that is just the number of people in recent weeks who've filed for unemployment compensation. And obviously, many of those people not only have lost their jobs, but also their health insurance. A survey or a report by the Economic Policy Institute a few days ago showed that by April the 11th, probably as many as 9 million Americans had lost their health insurance along with their jobs. And I'm sure by now that number is even higher. Even before this pandemic, we had almost 30 million people who were uninsured, which is an increase over recent years. The Affordable Care Act, as we all know, did bring that number down, but for various reasons, the number has begun to creep up. But not only that, as we all know, the number of people who are inadequately insured has really accelerated since the passage of the Affordable Care Act, which, despite some of the good that it did, kind of locked in the role that private insurance companies play in our system. In many ways, it really did give the keys to our healthcare system to private insurance companies. And they have continued on their strategy that was one of the motivating factors for me to leave my job, which was to get every one of us into a high deductible plan. And as a consequence of that, an estimated 70 to 80 million Americans who have coverage are underinsured, because in most cases they have deductibles that they just simply cannot meet. And that is the reason why so many people with insurance have to turn to GoFundMe or even bankruptcy court when they get sick or injured, because they can't afford, they don't have enough money to meet their deductibles. So that is a problem, and another reason why we need to continue on the fight and support for Medicare for all. But the pandemic, as I said earlier, is making it abundantly clear to Americans and candidates that the system that we have, in which so many people are dependent on their employers for health insurance, is just not working. And it hasn't been working for many years, by the way. Even during the early debates, many Democrats on on the campaign trail were saying that the employer-based system for all was largely sacred, that people liked their insurance, didn't want to see it replaced, and so they got away with that because we didn't have at that point this kind of a test so that people can see just how fragile and how insecure that system is. But now they are. I wish, by the way, that we could have a debate with all those candidates on the stage now, and I would dare any one of them to say, as Amy Klobuchar did, and Joe Biden did, and Pete Buttigieg did, that people like their insurance companies and don't want to have Medicare for all. I don't think anyone would dare say that now when we're seeing that people are losing their coverage along with their jobs. The other thing that I think that's important is that the cost of healthcare has been going up at a record pace even since the Affordable Care Act was passed. And that is something that clearly policymakers are beginning to understand. So I'll just end that part of my presentation, but just saying that I think this is a moment that we need to a large extent, take advantage of and make sure that those that we talk to, that we are bringing home the point that the system that we have now is very unreliable, very insecure, and also far more expensive than if we had a system of Medicare for all in which everyone was covered. Now I'm going to talk a little bit about the organizations that I now lead and why I think they are very important and will continue to be playing an important role as we go forward. As Debbie mentioned, I lead an organization called Business for Medicare for All. That is an organization that I founded with Richard Master. In fact, Richard played a key role in persuading me to become a vocal advocate for Medicare for All. I've been a longtime critic of the insurance industry, but I had kind of held back in support for Medicare for All because I knew how my old industry would be spending whatever it took to try to keep this from ever happening. But I became aware through working with Richard just how difficult it is for employers of all sizes to continue to offer coverage to their workers. And again, some of those candidates on the debate stage said that 150 million Americans have their coverage to the workplace and don't want to lose it. What they didn't say was that 20 years ago, more Americans had insurance through the workplace than they do now. At least 10 million more did. And during those 20 years, the population of this country has increased by 50 million. So this is a means of having access to healthcare that has been crumbling for decades now. And now we're seeing it collapsing pretty rapidly. But Richard helped me understand that employers are having a difficult time continuing to offer meaningful coverage to their workforce. They've been hit year after year since the Affordable Care Act was passed, certainly before, but also since. They've been hit with rate increases that are, in many cases, unanticipated and increasingly unaffordable. And their only option is to shift more of the cost of coverage to their workers and to push them increasingly into these plans with higher and higher deductibles. And that's just not sustainable. I think we all would have to agree that there is some point in which employers are going to cry uncle. This just doesn't work. And increasingly they have. Most small businesses in this country now do not offer coverage. And mid-sized companies are struggling to offer coverage. And the only employers that really are able to keep this game going are the very largest employers who, even though their rates continue to go up too, they see the current system as a way for them to recruit and retain talent. And that, of course, is a disadvantage to small and mid-sized employers that are having difficulty offering benefits. Even Warren Buffett has said that our healthcare system is the tapeworm that is destroying American competitiveness. So if you have someone who understands business and investing like Warren Buffett does, saying things like that, increasingly employers or other employers are saying the same thing. This just is not working. So with the business leaders for Medicare for All, we bring the business voice to this work. We help people understand policymakers understand why business leaders are supporting this. We now have more than 3,000 member companies from across the country that represents every single state. We have and there are businesses of all sizes who have joined us in saying we've got to replace this, and Medicare for All is a system that makes most sense. And the other organization that I lead is Medicare for All Now. Both of these organizations, of course, are nonprofit. The first one, Business Leaders for Business for Medicare for All Now, is a 501c3. Medicare for All Now is a 501c4. We raise small dollar donations through that organization. We have, among other things, we've hired people to be canvassers in South Carolina in advance of that primary. What we do now, largely through that organization, but also through Business for Medicare for All Now, is lead an effort to push out positive information about Medicare for All and to rebut negative information and misinformation and the propaganda that comes from my old industry. And I think that is probably the most important work that we are doing and that I can do. I continue certainly to be a vocal opponent of continuing on with insurance companies running our healthcare system. I continue to be a very vocal critic of the industry. But we also are operating through that work a war room that we have launched. It's still it needs more resources, but we've achieved quite a bit of success in my view over the recent months in rebutting the misinformation from the industry and from its front group, which many of you probably know of, called the Partnership for America's Healthcare Future, which is a front group that I would be working with had I not left the industry when I did. But with the work that we're doing, we're trying to make sure that not only is the media informed, we work to help shape media stories, to place op-eds. I've had a number of op-eds in the New York Times, the Guardian, and many other publications in recent weeks and recent months. But we also work with individual reporters to help them understand the healthcare system and how Medicare for All can be the solution to so many problems that our healthcare system and Americans are facing and businesses are facing. So, folks, this is something that we absolutely can win. Despite the disappointment that Bernie Sanders' campaign is not going forward at this point, we need to continue the work that he championed. I think we all owe him a great debt of gratitude for being consistent in his support and continuing with that. We need to work with other candidates and support other candidates down ballot. Just yesterday, I participated in a webinar not unlike this one with Andrew Romanoff, who's a candidate for Senate in Colorado. He invited me to be a part of this. Other candidates have done that as well too. So part of the work that we're doing is to provide support to people who are offering themselves up for public service, who are running for Congress or for the Senate. It's going to be very, very important for us to increase the number of members of Congress who support this. In the House side, as you probably know, more than half of the Democratic caucus has signed. They have signed on as co-sponsors of Pramila Jayapal's bill to create a single-payer program, a Medicare for All program. We need to increase that number, and we need to get more of the House leaders on board with that. So that's part of the work that we're doing as well too. I spend a lot of time talking with members of Congress and staff. Yesterday, I was on the phone with a staffer, a legislative assistant with Congresswoman Katie Porter. One of the things we're doing, by the way, right now is calling attention to the egregious practices of one big health insurer in particular, United Healthcare, which as this pandemic was beginning, I learned that that company has been terminating the contracts with a lot of physician groups around the country, including physicians who work in hospitals, those doctors who are hospital-based and are on the front lines treating patients during this pandemic. And that includes ER doctors and radiologists and anesthesiologists. United Healthcare, because it's so big and able to do this, has been giving these doctors an ultimatum. Accept a 50% to 60% cut in what we pay you, a reimbursement, or we're going to kick you out of network. And that's exactly what they've been doing. Just at a time when we need these doctors, we need to make sure that they are in our networks, but United, because they can, and as a way to increase their profitability, has been kicking a lot of physicians and physician groups out of network. So we're working with members of Congress and the media to raise the awareness of what this one particular insurance company is doing. That's kind of an example of the work that we're able to do. And I was on the phone with, and have been on the phone with, a lot of reporters over recent days. The other thing that we're doing, by the way, through our communications work is using social media in a much more effective way. I do a lot of work now through Twitter. I've got a very significant number of followers now. It's really increased over the last few months, and that again is the result of the work of the team that I've brought together to help with this war room. And I have a lot of members of Congress and staff and media who follow me on Twitter. So that has become a very key way of communicating and helping people understand why our current system is broken and why we need to move to Medicare for all. I'm going to end there because I'd like to move to our time to just have a conversation, to answer questions you might have, to hear what's on your mind, and to see how we can continue to work together to make sure that we're making progress and what that progress looks like as we go into the future. Thanks very much.
Thank you, Wendell. As a reminder, if you would like to ask a question, you can do that by raising your hand, and the controls over on the right-hand side underneath the list of participants. If you're on a phone, you can raise your hand by pressing *9. Okay, so we would ask you to raise your hand. They will show up in my list in the order in which you've raised your hand. And that you can also ask a question through the chat feature, and we're going to kind of alternate between those two. NJ, Nat Nordsey Jones, and John Ross are going to be monitoring the raised hands, and so they will alternate. And then Bill Davis will be monitoring the chat for questions, and he will read your questions. We would ask that you make it a question and not a speech, because everyone wants to have a chance to have their question answered. Okay, NJ, you want to start?
Sure. So it looks like our first question comes from Jamie Robinson. Go ahead, Jamie.
Yes, my question is, if a lot of this is based on lobbying and money to our lawmakers, how is it that any kind of like moral or ethical argument is going to be able to overcome this?
It's a good question, and and the moral and ethical arguments are not enough to overcome this. As some of you know, I've also been an advocate of overhauling our political system as well too. My most recent book is called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. So those of us who are advocates, we need to join that fight too, to clean up our political system, to reduce the power influence of lobbyists. We need to put a lot of pressure on the Biden team and also on candidates. We need to support candidates who are running for public office who refuse to accept money from corporations and from big PACs. And there are some, like Andrew Romanoff, who I was talking with yesterday and during that webinar. He has refused to accept money from corporations and political action committees. That's very, very important. When she was still running for president and throughout her career, Elizabeth Warren has also talked about the corrupting influence of money in politics. So this absolutely is something that we need to focus on in addition to supporting meaningful healthcare reform. We have to support just as forcefully efforts to reduce the power and influence of money. That can be done in many ways but there are some things that the next president can do, even through executive order, but also working with Congress in many ways to make sure that lobbyists are less able to influence members of Congress and how they vote, and also curtail the way that they are able to influence candidates through campaign contributions. It can be done, but it takes a willing Congress and more members of Congress who understand and support that. As you may know, legislation was introduced at the beginning of this Congress in 2019, to really have an impact on reducing the ability of big corporations and special interests to control the political process and legislation. So we need to elect champions of political reform as well.
We're lucky here in Ohio. We have a very active Move to Amend group that is working on that issue. And Greg Coleridge is on this call. And I would ask Greg to please post in the chat some contact information so that participants who are interested can get in contact with the Move to Amend group and help along that front too, because we really are intertwined. We're not going to get one without the other.
Very, very important.
Yep. Hey, John, you're up. Do you have a?
I'm going to go ahead and put James Binder on. He's a physician down in Cincinnati. So can I unmute him, Deb?
Yes, you can.
I'll do it.
Thanks, John.
All right, Jim, you want to talk?
Work and the way you what you're doing. My question is this: I feel that the virus that's current has such a passion, and it so demonstrates the need for single payer and a better public health system, that I want something to change. And I like your idea of the war room that you're doing with business. Does it make sense to focus, maybe for me, this group of trying to get college students, especially nursing students and pre-med students, and their passion? I'm thinking of trying to in that direction, but something to actually make something change. And I just want to get your thoughts on that.
I think that's very important. What I have found as I've traveled around the country when I could travel, that young people who are in med school, nursing school, really support this far more than I expected. I've spoken at medical schools all across the country, and nursing schools as well too. Worked with organizations like National Nurses United and Physicians for National Health Program, and local organizations too, or their state-based affiliates. And I mentioned South Carolina. We worked with medical students there who helped lead a rally or two when we were down there, and went canvassing with us in many cases. I think that's very, very important. Well, you'll find that a lot of young people are very supportive of moving to Medicare for all, and I encourage you to reach out to them, support them, and bring them into this work, and help elevate their voices. I couldn't agree more.
Good. Bill Davis, do you want to read a question from the chat for us?
Sure. Bob Crazen asked if you see Obamacare as a help or hindrance to Medicare for all?
You know, initially I think it was certainly a hindrance, and it delayed it delayed us getting Medicare for all. I think I would say that. I was in Washington a lot, as I mentioned earlier, as Congress was debating reform, and watched the legislation as it took shape, and I saw how it was being influenced by industry. I did ultimately say that I supported the bill, that I thought it should be passed. So did Bernie Sanders and others who are champions of single-payer health care. They ultimately voted for it because there was, at the time that the bill was passed, we had about 50 million Americans who didn't have health insurance. So at least it was seen as a temporary measure to try to stop the bleeding, if you will, to bring relief to a lot of people, and it has. Debbie mentioned Donna Smith, who has long been an advocate for single-payer health care, and she was able to enroll in an Obamacare plan. So it truly has been a lifesaver for a lot of folks, people who had pre-existing conditions who couldn't get coverage at any price before the bill was passed. It did serve a good purpose. But I said at the time that it was what I reviewed as the end of the beginning of reform. And also, as I said, in the 10 years since it has been law, we've seen some, I would think, unintended consequences. I can't imagine that those who voted for the bill and helped draft the bill would have anticipated that insurance companies would be able to do what they have been able to do to push so many of us into inadequate health insurance plans and to throw up more and more barriers for people to get the care that they need. I was, for example, an advocate of the inclusion in the bill of restrictions on how much or requirements that insurance companies spend at least 80 to 85% of what we pay in our premiums on health care. But what I also knew was that if insurers saw this as a way that would make it more difficult for them, or a provision that would make it more difficult for them to meet the profits that Wall Street expects, they'd find other ways to make sure that they were meeting Wall Street's expectations. And they have. They've gotten more aggressive with their prior authorization requirements, like the one that led to Natalie Sarkeesian's death. So these requirements are continuing to result in delays in people getting the care that they need and needless deaths. So in many ways, I think the Affordable Care Act has done some good. It has, I think, delayed our getting to having a single-payer healthcare system, but many people undoubtedly are alive today because of it. We just need to make sure that policymakers or candidates who are running for public office know that it was just a temporary fix, and that we really need to move to something that is truly transformative, and getting the ultimate goal, in my view, is getting private insurance companies out of the mix here.
Okay, thank you. NJ.
Next up, we have Antonia. Go ahead. Antonia, you still there?
Antonia Scacco.
Maybe she's muted.
No, she's been unmuted.
Muted.
Okay.
All right. Let me see. So let's go to Ted Seuss then. Ted, go ahead.
All right, I have just a real quick comment and then a question for Mr. Potter. An earlier speaker raised the question about how can we speak to people who don't buy into the morality of this issue. And we have a wonderful booklet that we paid for, written by Gerald Friedman, that's titled Economic Analysis of Single-Payer Healthcare in Ohio, and it goes on. And there are tremendous arguments in there just for the economics of a single-payer healthcare that speak to fiscal conservatives. In fact, in Region 1, we have a document that we use regularly, especially when we're doing town halls and we're speaking publicly, titled A Fiscal Conservative's Case for Single-Payer in Healthcare. And of the 12 items in that, the first 9 come right out of Mr. Friedman's booklet. So just want to remind us all of that. My question for you, Mr. Potter, is you have an organization, Business for Medicare for All, and we've often talked back here about approaching businesses and getting businesses on board. And I'd just like to know what your recommendations are in terms of how we can do that and tools that we can use. Other than the ones I just mentioned, but I'm sure that you have more experience in that. So if you could share with us maybe what your organization does, if that's appropriate, or whatever your recommendations might be to help us go into the business communities, especially large companies, large corporations, and get them on board with this, because they benefit so much by it.
They absolutely do. I would start by trying to do some presentations or meetings with local chambers of commerce, and but also talking with individual business owners that you know, and tell them about our organization. Check out our website, by the way, businessformedicareforall.org, and reach out to Dan Barlow, who is our executive director, and Dan would love to talk with you about any businesses that you know of in the in your areas who would maybe find what we're doing of interest. But what you were saying, making the business argument is very important as you talk to business leaders. It's absolutely essential. I think you'll find that a lot of them do buy into the moral argument that healthcare is a human right, but know that there is language like that that often does not work, and sometimes it is more of a barrier than an aid when you talk to folks. So it's important, as you noted, Jerry Friedman's book and his work, the economic reasons why this makes sense, and lay out for business owners how the current system is a disadvantage to small businesses. In October, I traveled to New Hampshire and appeared with Bernie Sanders. My organizations don't endorse candidates, but we do agree to work with candidates by appearing with them and talking at town halls with them. And this was one that I was able to do in person back then. And it was a town hall with business owners in New Hampshire. Most of them were small business owners. Most of them were not able to offer benefits and never were able to. But one was a hardware store owner, been in the family for more than 100 years. And fairly recently, the owner had to make the decision to stop offering coverage because they just couldn't afford it anymore. So help them understand that if they're a small business, they are at a disadvantage because large employers, as I said earlier, they're able to recruit and retain employees in ways that small businesses cannot. Not only can they, in many cases, pay more, but they are able to offer benefits that small businesses now just cannot do. With large employers, it's a more difficult sell. But I think you begin by developing some relationships with a benefit manager or the CFO of a company. They are increasingly becoming aware, by the way, and I think that this opens the door for some conversations. Even large employers are beginning to realize that they've been sold a bill of goods by the health insurance industry. They are getting hit year after year with higher fees from insurance companies who manage their benefits. These companies are self-insured, these large companies, so they are the entities that actually bear the risk. They are actually the insurers, and they just have a relationship with the Cignas and Aetnas and Uniteds of the world to manage their benefits. But those fees keep going up, and even these large employers are finding that to keep their expenses down, they have to continue to shift more of the cost of the premiums and increase deductibles for their workers and their workers' dependents. So I would, once again, as you said, use the economic arguments and help them understand why the current system is broken for them as well as for other folks, and help them understand, as I think Elizabeth Warren tried to do, that even if you move to a Medicare for all type of system, even employers will be able to save money than they're spending now. So talk to them about. Hold on a second. Hold on. That's Charlie, by the way.
Well, I've been following the Wendell's adventures with Charlie, so I'm kind of glad Charlie had a chance to join us there.
Yes, Charlie wanted to join the conversation. Whenever the doorbell rings, Charlie gets excited. So meet Charlie. But just to wrap up there, Jerry Friedman and the work that he has done, and I work very closely with Jerry, has really put forth in a lot of his writings what the economic arguments are, and some of the work that we're doing at Business for Medicare for All helps employers understand how Medicare for All can actually save them money.
Okay, I see that Antonio Scacco is back, so let's give her a chance to ask her question since we missed her before. Tony, you are unmuted, so go ahead with your question, please. Tony? Okay, she's having some problems. Tony, why don't you try sending your question through the chat? Okay, you are unmuted. Go ahead and try.
Do you think maybe she's muted on her own computer?
Yeah, she may not, the sound may not be working on hers. So, okay. John, you're up next.
So I'm going to unmute Bob Kemp. Bob Kemp is a health economist who's worked in the pharmaceutical industry. So I'm going to go ahead and unmute him, and we'll see what he would like to ask Wendell.
I have one comment. Hi to everyone. I have one comment. I had a chance to teach health economics this last semester, and there was one stat that really stood out to me. From 1989 to 2012, if you look at the people who graduated from college from 1989 to 2012, their employers did not offer them health insurance. Health insurance coverage for that group went down from 53% to 31%. That means young people that are graduating from college who did the right thing, went out there, finished their classwork, got a degree and what have you. Only 31% of them are in jobs that are actually offering them health insurance. If you graduated from high school in that period of time, only 7% were offered health insurance. So I learn something every time I teach health economics. These are some economic policy numbers which show that the younger people are not getting covered, which I found just alarming. But my other my question is, do you think some kind of national health insurance strike would work? Because we're being told how happy people are with our health insurance, but we're not happy with it. We're afraid to tell our insurers or our employers about it. I'll just leave that with you. Like, suppose we took December off and we didn't pay the insurance company. Like 50 million of us didn't pay the insurance companies for 1 month. Would that work?
I don't know that it would. It's a good thought, but since they are so much in control, they will just send a notice that they're cutting off your insurance. Although, if it could be something that's truly national in scope and organized and seen as a demonstration, it could work. It absolutely could. And I think that has some merit. I don't know that anyone's ever tried to pull anything like that off, but it does have. I am interested in maybe trying to pursue that. It would raise awareness of just how unhappy people are with the coverage that they have. And that would include people who have coverage through Obamacare. As I've said, a lot of people now are underinsured. The Commonwealth Fund did a study just a couple of months ago that showed that at that time, 41% of people who have coverage through Obamacare, through the exchanges, are underinsured. So those folks, many of them are very unhappy with the kind of coverage that they have. They're probably happy that they have coverage, but they can't be happy with the way that the benefit plan is structured. And increasingly, people are finding that the doctors that they'd like to see or the hospitals that they'd like to go to are not in network anymore. So I think it really has merit, Bob. I'd be interested in maybe maybe organizations could come together and talk about something like that. How could a nationwide protest come together, and what would it look like? How could people really make sure the policymakers understand they do not love their health insurance companies and do not like the kind of coverage or the limitations of the coverage that they have, or spending so much money out of their own pockets before their coverage kicks in. I think that's a lot of merit, and maybe something that we could talk about, and organizations could come together and try to figure this out. I am interested in what you said about young people, and I would like to, if you can send me that data or any reports around that, I'd be very interested. I have talked a lot about the fact that people who are younger increasingly are not in jobs like I was, or many of us were, or our parents were, that offered benefits that were more reliable than they are today. A lot of people are not able to or want to work for big employers. A lot of people who are younger, by necessity or desire, are working in the so-called gig economy. And most of those folks don't have insurance. I've worked with a lot of folks who've led the movement for work at home, or in the shared office space. And a lot of the folks who work in shared office space settings are not insured for, in many cases, because they don't earn enough money to buy insurance, and or decide that it's just something that they think they can get away with for a while. So I do think that we can bring young people more than we have into this movement.
Thank you. Bill Davis, let's take a couple questions from the chat.
Okay. Boy, there's so many of them. I'm not sure where to start.
Can I make a suggestion, Deb? That we'll do our best with these chat questions, but maybe what we can do is to actually address each one of them. Will the chat be recorded as part of our recording, Bill?
I'm trying to capture some, but I think we can capture the whole thing at the end.
Yeah, and if we can, then I think we could agree that we would do our best to try to answer some of those, even if Wendell can't stay with us to answer them, because some of them are things that are pretty much boilerplate, single payer 101 things that I think the team could probably help with.
Okay, was there a way to
have one here from Rachel DeGalia. She says, I understand that the funding coming to hospitals from the latest stimulus package is being run through United Healthcare instead of HHS. What can be done about that? How does that work if a hospital isn't in United Healthcare's network? I'm not sure if Wendell wants to take a stab at that, but you can try.
Yeah, I am very much aware of that, and I've tweeted about it. It's just outrageous that the Trump administration is using United Healthcare, is paying United Healthcare $1 million to dole out, I'm using that term, but obviously hospitals do need to have money from the federal government during this pandemic. But $30 billion from the stimulus bill is being distributed to hospitals by United Healthcare. Why? It defies logic. I was quoted in a Politico article a few days ago about this, and some reporters are raising this issue as an ethical issue and an issue that really needs scrutiny. There's there's an official in the Trump administration with ties to United Healthcare who appears to have been instrumental in getting this done. United, in its press release, said that it has relationships with more than 80% of hospitals around the country as a reason why it was chosen. But that makes no sense, because the Department of Health and Human Services and the Center for Medicare and Medicaid Services has relationships with virtually every hospital, 100% of them. So why turn to a private company to do this? Makes absolutely no sense. It's just a favor to a private company. And apparently that $1 million that United is getting as a fee for doing this, United gets to decide. United said it will use that charitably, and but they have decided. United has decided how to use that money in contributions. So it's a PR opportunity for United. It's just outrageous, and I think you should. One thing to do is to tell your member of Congress that this is just unacceptable, and write letters to the editor. There are many different things that one can do just to express outraged at some of the things that are going on. But that is absolutely, you're right, Rachel, something that is absolutely despicable that the Trump administration is doing.
I've got one more easy one, I think. Mary Sue Geminer was wondering what percentage of total health care dollars in the U.S. go to the health insurance industry?
Oh, it's a huge amount. I don't know that I can cite an absolute number, and it changes, but increasingly, our taxpayer dollars are flowing through the insurance industry. When I was still working for Cigna, a majority of the company's revenues certainly came from what we referred to as the commercial side, from employers primarily. But increasingly, since the Affordable Care Act has been passed, not that that was necessarily the reason for this, but it just has happened, more and more big insurers are getting the majority of their revenues from the government. I was looking at United's first quarter earnings report from a few days ago, just for the first 3 months of this year, and they're getting far more revenues now from the government than from the private sector. And that's primarily because they've become a very big player in Medicare Advantage. They operate a lot of the state's Medicaid programs. They sell Part D drug benefit plans. They sell Medicare supplement plans. So a lot of the money that they are taking in now comes from us as taxpayers. And reporters are not paying a lot of attention to this. Most people are not even aware of it. So that is something that I'm trying to raise awareness of and make sure that policymakers are aware of this as well too. You'd never know this unless you pay attention to the earnings reports. So that's something I would encourage everyone to do. The reports can be kind of difficult to decipher, but if you can look, you can tell, you can see the evidence that more and more of our money that we're paying in taxes is flowing through these big insurance companies, and they're using that to convert a significant percentage of that to profits. It's an outrage.
Okay. Does anybody else have questions that I should let go to?
I see we have one more question from Matt Weaver. Do we want to go to that one quickly?
Yes.
So Matt Weaver is one of our brothers from the Brotherhood of Maintenance of Way employees and a good supporter of single payer. Go ahead, Matt.
Good morning, everyone. I just had a question because I see it a lot. I talk to thousands of our guys, and they think that railroaders have really good health care, and they want to know why they would risk what they have for anything else that we ever talk about. And it's not really good health care. When I hired in, there were no co-pays, deductibles. Now we're paying as much as almost everyone else, but we do have good health care, but it's not great. What are your thoughts on how do you convince someone who has health care how we welcome everyone else in to bring us all up together?
What I would do is say that if you are enrolled in Medicare, you don't have to worry about it going away. You may recall that leading up to the Nevada caucus, there was a lot of publicity around the fact that the Culinary Workers Institute, or the Culinary Workers Union, was encouraging their members not to vote for Bernie Sanders because he advocated Medicare for all. And they were trying to send the message that that union workers did not support Medicare for all. And of course, the leadership of unions wants membership to buy into the notion that they're working on their behalf, and they have in many cases negotiated better benefits than people who are in non-union jobs. So there is that. That's important to note and to recognize. But it's also important to note and recognize that the value of those benefits, even with union leaders helping to make sure that the benefit plans are as good as they can be, nonetheless, the value has diminished over the years in that people who are union members are having to pay more out of their own pockets for the premiums, or their share of the premiums in many cases, but also they're not immune from these high deductible plans. And and limited networks. So that's one thing. The other is just to use this current situation as a teaching moment. A lot of union members are among those who've lost their jobs. So you might say that, I'm a member of a union. I have a plan that is better than somebody else who lives next door and is not in the union plan. Nonetheless, you might be among those who are now in the ranks of the uninsured as you've been laid off. So I think that is the biggest argument. Why do you want to support a system that is so insecure? People go year after year thinking that they give little thought to their health insurance, particularly if it's through their employer, that, okay, I've got it made. I've got health insurance, without giving a thought to the fact that their employers are in control. Their employers pick the company that is their insurer. People don't have the choice that they have been led to think that they have. So number one, it is usually the employer, in some cases maybe working with the union, that picks the insurance company. But is the employer largely that's in control to determine what the benefit plan looks like, what the deductibles are going to be. And over the year, there's a term in the insurance business that you probably have never heard of because it's just spoken about with investors. It's called benefit buy down. And even in unions or union plans or plans that there's been some union involvement in negotiating the benefits, it's still subject to benefit buy down. And that's a term that covers all the different things that insurance companies can do to avoid paying claims, or at least to enable them to make the profits that they want to make. And that includes aggressive prior authorization. That's something that union members need to know too, that as long as you have a coverage that's administered by, or it's in the private sector, there's going to be a doctor or a nurse who is in the position of saying, no, we're not going to cover that, even if it's a covered benefit. That doesn't happen in Medicare. You have a much broader choice of healthcare providers under Medicare for All than in any private plan. And you don't have, under what we're proposing, improved and expanded Medicare, out-of-pocket expenses like even union members are being exposed to. Plus, that ultimate reason, I think, is that you have the peace of mind of knowing that plan is going to be there for you. It's not dependent on the whims of your employer or economics or a pandemic, and you can lose your coverage along with your job.
Okay, we've got several hands up. NJ?
Sure. So next we'll go to Dee Chavez. Dee, go ahead.
Referring to a question on the chat line that Daniel Skinner asked, we haven't gotten to yet. As we know, Joe Biden's campaign was fueled largely, or in a great amount, by people of color, and Sanders was not able to bring that into his campaign. And I've found that to be true in our SPAN work. We've gone to organizations where they're mostly people of color, but we can't seem to draw them in to be activists and to get very involved to a large extent. And I'm wondering if you have any ideas, or has Business for Medicare for All done anything to reach out to that community?
We have, and you're right. It is a challenge. The work that we did in South Carolina that I mentioned earlier through Medicare for All Now was to have folks on the ground who worked with us. We had canvassers who went door to door, primarily in the African American communities, the Black communities of South Carolina. And I joined them in many cases, knocking on doors in Black neighborhoods. And what we found was that there is broad support for Medicare for All, but a lot of those folks wound up voting for Joe Biden anyway, partly because of Congressman Clyburn's endorsement just the day before the primary there. It was unbelievably influential. So you've got the loyalties of the Black community in many cases to Joe Biden because of his serving as vice president for President Obama for 8 years. So that's just something you need to recognize. And I noted earlier that even among those who voted throughout the country, regardless of color, many of them voted for candidates who don't support or were not vocal in support for Medicare for all. I think but it's important to do the kind of work that we did in South Carolina on an ongoing basis. Talk with folks in the Black community. Go to their places of business. Go to speak at churches. That's one of the things we did, and recruit people of color to be a part of the movement. As I've talked to folks around the country, generally the audiences are largely white, which is discouraging. I think we've not done enough as a movement to reach out to the Black community and to help them understand how Medicare for all would be of great benefit, and to help explain the vast inequities of and unfairness of our healthcare system. I don't think that we've done a very good job of doing that, of bringing them into the movement and explaining how what we're proposing would be of great benefit to them. So I think it's largely on us to really redouble our efforts or to have a focus on doing that. I'm sure many of you have done that, but it is something that's going to be especially important. Regarding Joe Biden, I think I think that we need, as I had mentioned somewhat earlier, also to keep the pressure on him to make sure that he and his team understands there is still strong and solid and growing support for Medicare for all, and that there are ways that we can, as a movement, put pressure on him and his campaign team, and if we're lucky enough for there to be a transition team and a Biden administration, to continue to put pressure on him. And I think one way, obviously, of being successful in that is to make sure that the African American community supports what we support.
Thank you, Wendell. I want to ask David Melender, did I lower your hand or did you? And let me find you again.
He's up, raised again.
He's what? Oh, he's raised again? Okay, I must have lowered his hand. So let's go to David. Okay, David.
Hey, thanks. So my question is, it seems that Medicare for All gets beat up because of that claim that it'll result in a tax increase. And as someone put in the chat, thank you, Grover Norquist, for making tax a bad word. It seems that Elizabeth Warren tried to make the case for Medicare for All, saying that we need to look at total cost, where any increase in taxes is less than the amount that you currently pay for insurance. But it seems like the problem is getting people to understand what they pay for insurance because of the lack of transparency and the incremental and different sources that we use to fund insurance, where you've got your employer premium contribution, the employee contribution, deductibles, co-insurance, out-of-pockets. So are you aware of any movement or interest among policymakers to make the current insurance funding structure more transparent, make it a more blunt or in-your-face explanation of how much you and your employer actually pay for your private insurance, that money that gets turned over to those companies instead of being paid to you, the employee, as additional wages?
No, I haven't. That's a very good point and good question. I think one reason our opposition, those who oppose us, are so successful is using tax. They play the tax card. I've said that many times. That is probably their most important propaganda point, is scaring people away from this by calling it among other things, the government takeover of healthcare, government healthcare. Again, that goes back to Grover Norquist being so successful with a lot of help from corporations and conservatives broadly. But that's a good idea, to require employers maybe to be even more explicit about how much of their pay is going to health insurance companies and how much their employers are. There is not that much of awareness. People don't realize that as premiums go up, there's less money available for them to get in the form of wages. So that is a good idea that I've not heard anyone ask, and I'm not sure how it can be pulled off, but there really needs to be an effort for people to understand that. I often, as I talk to groups, say, you've got to understand money is money. And we're talking about a system in which you will have more money in your own pocket. Who would be opposed to that? Not only can avoid spending some money for health insurance through Medicare for all, you will not have these out-of-pocket expenses. So just try to, as you're talking to people, help them understand that they can actually benefit by keeping more money in their pockets, and as employers are less burdened with providing health insurance, they will have more money to give you a raise, and that the reason you have not gotten raises that you otherwise would have is because so much of the money that your employer is spending on your behalf for benefits is going to insurance companies. People need to understand that that is a part of their compensation, and I don't think many people really understand that. They think their employers are just being benevolent to do this. There needs to be a greater understanding of the fact that this is their money, the employer's money, and a lot of it is going to insurance companies.
Hey, I don't know who's up for the.
We have one.
Yeah, Donald Nguyen's been there a while. Shall we hear what he has to ask?
Don Nguyen is another great
And
physician.
just an announcement, we are saving the chat, and we will answer all the questions in the chat if we don't have time to do it on this program. I'm willing to keep going as long as Wendell's willing to keep answering questions. So,
Sure.
Yeah. Okay, Don.
Don, you're up. Go ahead.
Thank you. Wendell, greetings from Dayton. Every day America is inundated by ads from insurance companies that portray themselves as goody-goody companies, a necessity for society, values, respecting very nice companies, and then that's sort of like seeping into the American psyche. So if we are going to defeat insurance companies at all cost, what do you think of a frontal attack with this type of the same ad that we can perhaps put on, pointing out many things that we all know that you have pointed out. So on the internet, you see some memes about CEOs making gazillions of dollars and whatever. But what about attacking these insurance companies frontally on the same playing field as they are on television, that sort of thing? And I don't see that sort of talk about how we attack the insurance companies directly at their pocketbook and that sort of thing.
Don, hello. It's good to hear your voice, and greetings from Philadelphia. I hope you all in Dayton are doing well. You're exactly right to raise this point. One of the ways that our money is spent, some of our premium dollars, finances these image campaigns by insurance companies. I see them here in Philadelphia. Independence Blue Cross they spend boatloads of money on newspaper ads, TV ads, sponsoring this or that. People don't give it a second thought. They don't realize that we're paying for that through our premiums. It's just not an awareness. So that is something, you're exactly right. We need to try to figure out how can we make sure the public is aware that it's not Blue Cross spending its money, it is our money that they're spending, and our hard-earned money. The other point, though, is that it costs a lot of money, and I haven't seen that the advocacy community has the means to raise anywhere close to as much money as they are able to spend to do these advertising campaigns. That said, that doesn't mean that we can't fight back, and that's one of the things that my organizations are doing, particularly through Medicare for All now. We're becoming increasingly active on social media, Facebook in particular. I mentioned Twitter a few minutes ago. I'm very active on Twitter these days, but increasingly we're going to be using Facebook and Facebook ads. And a big part of the work that I'll be doing through Medicare for All now will be to push back against the insurance industry. One of the reasons I continue to do the work I'm doing is because in many ways is to make amends for what I used to do for a living working for the insurance business. There's so much that we need to push back on and attack this industry. And that's a lot of the work that you'll be seeing that Medicare for All now does. So it's very, I'm not going to make a solicitation here, but as I said earlier, we rely on small dollar donations for people who support the work that we're doing. And I don't know of any other organization that is as focused as we are in trying to push back against industry lies and to do the work of helping people understand just how horrible these companies are and what they're doing.
Thank you. Bill, we'll take one from the chat if you've got one.
Okay. Tim Bruce asked about, he said Biden's plan is a so-called public option. Will that be beneficial for moving Medicare for All forward?
I'm a skeptic of the public option. And I think probably the majority of single-payer healthcare advocates are skeptical as well too. During the 10 years ago, there was a lot of support for a public option because back then it was as good as we could get, and we saw that obviously was stripped out of the final bill. Had it passed, by the time it had gone through the committee process, and as the House passed, the House did, by the way, pass a version of the bill that did have the public option, but it didn't wind up in the final bill for various reasons. It would have been quite a weak public option. So one thing is that if the Biden administration continues to advocate or propose a public option, details matter, and we would need to make sure that we're keeping a close eye on how that is being proposed to be developed. It cannot operate just like another private plan does with high deductibles and limited networks and prior authorization requirements. It would be, in my view, just useless if it is just nothing more than a government copy private plan. That's one thing. The other is I'm skeptical that it would work even if it is a pretty decent option, because you have this situation that we've seen in history in which the insurance industry is able to rig the system to its advantage. If you have a public option and it has good benefits and relatively modest out-of-pocket, if any, out-of-pocket obligations, then it will attract, at first, people who have pre-existing conditions, people who are most likely to enroll in a public plan. But you would have the insurance companies having the ability to offer coverage at lower premiums and attract people who are healthier and younger. That's what they've done throughout history. It's why we have the system we have now. So I am just a real skeptic that having a public option would work. And if you have a dynamic like that sets up, it creates something that's referred to as a death spiral, in which the public option would cost taxpayers more and more, and the offerings from the private insurance industry would be perceived to be less expensive. Their premiums could be less expensive, for example. So I am just a real skeptic that it could be put together in a way that would really work and could be sustained and cost effective. I'm just not sold on the idea. We'll have to watch it very carefully because I suspect there will be a lot of support for it because a lot of so-called centrist Democrats think that it is something that could work. But the devil's in the details, and it may be that we'll have to try it to see just what happens before we move on to full Medicare for all. But I'm not a fan. at this point.
Okay.
We have one more hand up in the here in the audience. Sandy, I think you are up next. Let me go ahead and you're unmuted, Sandy. Go ahead.
Great, thanks. Fascinating so far. The main argument I hear against national health care is that it's completely unaffordable. The country cannot put this vast amount of money into it. And I've been to SPAN conferences before, and I know that a huge percentage of the money that goes into healthcare is going to CEOs, is going to the endless paperwork, those kind of wasteful ventures. So what I'm asking you, and I don't know if this is possible, but do you have a shorthand way of responding to that concern that this country cannot afford it? Other than that, so many other countries are doing it, why can't we? But you know, I always get the response that, well, we're different, it's not going to work here.
I wish there were a way to answer that in 25 words or less. But the challenge that we always have when we're advocating for something positive is that it takes more words to explain something than it does to condemn something, like calling something a government takeover of healthcare. You know, that's pretty effective when you're trying to stop reform. But I think we need to help people understand that we spend twice as much money for healthcare on average as any other developed country, and we get far less for it. About a third of what we spend on healthcare annually does go to things that are not necessary, like advertising, like Don brought up a few minutes ago, like executive compensation, like rewarding shareholders so that they can have a profit through sales and marketing expenses that are not necessary. So a big part of what we spend in our premiums don't help us get well or from getting sick in the first place. It goes to line the pockets of rich executives and shareholders, and it is spent needlessly on administrative overhead. Can you say that more cogently? I think you probably can, but it is useful sometimes to use a graphic to help people understand where your premium dollar goes, and compare that to where it goes to in Canada. Yes, we're different, but not that different. Why in the world do we have to spend twice as much as Canada does and our outcomes be worse for it, and still have 30 million people and growing who are uninsured, and 70 million people are underinsured? It's, for some people, I will just say this, they're not persuadable. But if you've got someone who's at least willing to listen to you, I think you can maybe use Jerry Friedman's book and some of the things that he's laid out. I think making the economic argument makes sense for a lot of skeptics that have just not bought in fully yet. But this can be done in a more cost-effective way, and you can have benefits that are better than what you're getting now, and pay less out of your own pocket than is the case now. Sometimes explaining to them in economic terms is a more appropriate way to go for people who are not persuaded otherwise, and can't be persuaded just by mouthing what we've often said in the past, that healthcare is a human right. That just doesn't cut it for people who are not already with us.
Wendell, I have a question. Bernie Sanders and Pramila Jayapal have come together to propose legislation for the Healthcare Emergency Guarantee Act. And what it would do is the government would cover all healthcare costs, not just pandemic related, for all of the uninsured, and would cover the out-of-pocket expenses for all of those who have insurance through this entire pandemic until the crisis is over. Is that a good way in?
It is a start. I think that is. I support that. I think that has a lot of merit. Separately, Congresswoman Jayapal is also going to be introducing a bill this coming week that would automatically enroll people who are uninsured into the Medicare program, which I think is also a good way to go. And as I was saying in an interview not long ago, the Medicare program has been expanded since it was created in the 1960s. As I think most of us know, it now covers patients who have kidney disease and people with disabilities to a certain extent. So we have in our past expanded, not many times, but there has been an expansion of the Medicare program to cover people who are not 65 and over. I've worked with Jerry Freeman actually on an op-ed that I believe will be in a publication called The Hill in the coming days that supports the idea of expanding the Medicare program to cover people who are newly unemployed and uninsured because of this pandemic. As you may know, the insurance industry is proposing something that seems as if Speaker Pelosi and House leaders are endorsing, which is to have the government pay the full premium for COBRA coverage for those who are now newly uninsured and have lost their employer's sponsored health insurance. That probably is going to get a lot of support. Even Debbie Dingell, who is Congresswoman Jayapal's lead co-sponsor for her Medicare for All bill, has signed on supporting having taxpayers pay the full amount of COBRA coverage for those during this pandemic. Who knows how long that's going to last? But that has quite a bit of support apparently. I think that Jayapal's approach with what she is proposing jointly with Senator Sanders and also her separate bill, which I trust that Senator Sanders will also introduce in the Senate, to enroll everyone who's newly insured, or people who are uninsured right now, into the Medicare program, is a good step and a good option. And it would cost the country less to do that than it would be to have taxpayers pay for COBRA coverage, which is unbelievably expensive. Not only if you are, as you may know, if you lose your job and you have employers sponsored insurance, you are eligible for COBRA. But not only do you have to continue paying what you've been paying, your portion of premium, you also have to pick up what your employer was paying plus a 2% administrative fee. So little wonder, even though it's been an option since 1985, only about 10% of people who are eligible sign up for it. They just don't have the money to pay for it. So to go that way doesn't make a lot of sense economically when enrolling people in the Medicare program can be done quickly and less expensively.
$1 for a single person, and then for a family.
All right, we'll take one last question here. Joan, you are unmuted. Go ahead.
Hi, this has been a great discussion. I just have a quick thing I wanted to add about the money side when people say, well, we can't afford that. How can we afford that? And one of the things I like to point out, and I think this is correct, is that we pay taxes for both Medicare and Medicaid. And with Medicare for All, we wouldn't need Medicaid. It would be gone. That would be a huge tax savings right there. Would it also be correct to say that we would no longer need COBRA or workers' comp? That I'm not sure about.
Oh, absolutely. You would not need these other programs. Medicare beneficiaries Medicaid beneficiaries would be covered under this, the single payer plan, the Medicare program. And I think that would be a great benefit to even those who are on Medicaid. As we know, the Medicaid coverage varies from state to state. Some states have expanded their coverage while a few still have not. And the other thing that concerns me about our Medicaid program around the country is that increasingly states have turned over those programs to private insurance companies like United Healthcare to administer. So it's another opportunity for big health insurers to convert taxpayer dollars into profits. So I absolutely support moving people who are currently on Medicaid into the Medicare program. There would not need to be a COBRA program because people would not have coverage or have to rely on their employers for coverage. So their benefits would be more secure. They would not disappear if our jobs disappear. Workers' comp, most of the expense when someone is disabled or has to leave work because of an illness or an injury pertains to healthcare costs. So there might need to be some provisions for making sure that people are covered if they are accidentally injured in the workplace, and the employer should be held somewhat responsible. But for a lot of the healthcare costs related to an accident or an illness for anyone who's employed, there would be no need for doing it the way we do now.
Thank you, Wendell. I've been asked to read this announcement. If you want to join Region 1 Cleveland Area SPAN meeting on Monday at 5 p.m., you need the login info. Email clevelandspan@spanohio.org. Also, let's see. I would like to show you how you can get more involved. And we'll go to, can you see the SPAN Ohio webpage there? Along the top, you will see Join Us, and you can subscribe to the newsletter, which is for free, and Jonathan Ross is our newsletter editor. Or you can initiate or renew a membership, and the membership is $40. Normally, we have senior rates at $20. And if you have a hardship situation, let us know and we'll make arrangements for you. We also have individual memberships and organizational memberships. So if you are part of an organization, your organization can join the SPAN Ohio. The other thing is, if you want to get involved locally, you can go to our regional coordinators, this list here, and we have contact information for all of our regional coordinators, so you can email them and tell them that you want to get involved. And and they've all kind of asked you to do that, so this is a good place to do that. So, okay, anybody else have anything for the good of the cause?
I might just comment, some people aren't joiners, but we could always use your money to push this forward, and so could Wendell. So if you're not a joiner, but you still want to support us, you got a donate button on that website too, and so does Wendell, I'm sure, on his website for Business for Medicare for All. So I would encourage anybody who doesn't necessarily want to be a member, but still would give us some money. That'll help us to continue the good work we're trying to do.
Correct, because it does cost some money when we can get back together and we go in and we lobby. The last session we were very successful and we got proponent testimony on our bill, and that was with a conservatively dominated legislature and a chairperson of the committee who is extremely conservative, but was willing to listen and was willing to have the conversation. So it is a possibility, and we're working to try and do that again, because the more often that we have these hearings, the more discussion that takes place, the more people learn about it and come and decide that maybe this is something we can do. There were a number of legislators that surprised me the last time and came up and said, I could do this. I just have some questions. I'm not totally opposed to this. So we are making huge progress, and we want to continue to make that huge progress. Now, we have saved the chat. We will work on answering these questions and get the answers out to you. We do have a report of everyone that registered for the conference, and we will send out the chat answers to everyone that was registered for this conference. And we'll probably also be posting them on our website as well. Also, remember, May 24th, we will have Alex Lawson from Social Security Works So there are talks about how we need to cut Social Security again to help pay for the pandemic. We need to listen to what Alex has to say on why that's not necessary. And Melinda St. Louis from Public Citizen will be here to talk about their campaign to push Medicare for all at the national level by getting endorsements from city councils, county councils, and elective bodies. And we have had some success here in Ohio. We have Lucas County that endorsed it, and we have Newburgh Heights, and we're working on some others. So, Bob Crazen, I'm going to unmute you for.
Yes, is a YouTube rendition of this conference going to be posted?
Yes. We will do that. Thank you. So, D. Chavez?
When will that be? Do you know, Debbie? The YouTube, when will that be available?
It depends on how soon we can get it done.
Okay.
And
yeah.
Jake's working on that.
I also want to give a shout out to two of our state representatives who are attending, George Lang from Butler County, and I believe Catherine Ingram from Hamilton County is on here. I haven't seen her yet, but I think she's here, so. Thank you for attending.
Register, and we want to thank George for joining us. George was with us last year, and George desperately wants us to convince him. So, back to George for having an open mind about that. Also, we have Melody Hart from the Cleveland Heights City Council who joined us today.
Okay.
So, well, thank you, everyone. Thank you to Wendell. You did an excellent job. We are thrilled to have had you, and hopefully we can do this again sometime, and in person.
I hope so. Look forward to that. Thank you all very much. Thank you for inviting me. Thank you for all your advocacy, all your work, for giving up your Saturday to be a part of this, or at least a part of your Saturday, and appreciate the opportunity.
Okay, thank you, and I'm going to end the meeting now.
Bye.